Namaskar, viewers. Today is the first episode of our health question series. In this series, today we have an oncologist to address the uh, general queries that any layman can have about breast cancer. And it is very unfortunate to say that this particular cancer has become the second largest in India. This cancer is causing death threat as well. So it's good to have an awareness about it and education about this so that in case, unfortunately, any one of us in our family face this issue, where do we go and how do we address this at a very primary stage? So it is my honor and privilege to welcome Dr. Vijayalakshmi Deshmane, retired as the head of the Department Oncology and director in the prestigious Kidwai Hospital, Bangalore. So let me first of all formally welcome Dr. Vijayalakshmi. So swagatam.
Thank you.
So doctor, first question. What are the symptoms of breast cancer?
A main symptom is in the breast cancer, lump in the breast.
Okay.
That is the main. 99% of the patients, they come with the breast in the lump in the breast.
Okay.
That is the main symptom. And God has placed breast superficially. We are able to, get we will be able to know at the earliest.
Okay. Okay. And it is an abnormal growth of a cell. That is what is called cancer. Am I right?
Yes. Lump is abnormal lump. Hard lump will be getting.
Okay. Is it generally on the breast or armpit also?
Armpit, no. Armpit, invariably they present to us with the majority of the times with a lump in the breast. This armpit, whatever we are getting is a spread there.
Okay.
From the breast lump, that spread occurs there. That is called a lymph node,
lymph node
involvement.
Okay. Now the next thing is how somebody can detect in early stage.
Early stage, it is as such, if they attend a program like this, whatever is happening today, that is one way of, getting the information. So I'll be able to tell how one can detect at the early stage and all that. It is easy again with the location. Location is so very superficial. It is not in the abdomen or the chest, in the cavity. It is outside. So because of that superficial location, we'll be able to detect. But with so many other things, with hesitation and all that shyness and all that, people will not come forward.
Right. But what are the ways to self-detect it?
What are the
ways to self-detect it?
Cells, as such, what happens is now things have developed so well. This was not the scenario earlier when I joined Kidwai Hospital 40 years back. So even including gynecologist from our place, they used to come in a very late stage. Late stage is stage 4. That this is going to the bone, liver, and all that with the spread everywhere. That was the scenario. Now, if they can go to the family doctor. If family doctor is little conscious about these things, they will be referring the patient to the cancer hospital.
Correct.
So once patient visits the cancer hospital, like Kidwai Cancer Hospital, this number 2 in India, where we get a lot of experts there. So we will be able to do the needle test, which is very, very simple. needle test, that is a fine needle aspiration cytology, we say. It's a very beautiful, this has revolutionized the treatment of breast cancer because, it is like an injection. Needle is fine, needle is passed into the tumor. This lump I was talking, it is called tumor.
Yes.
So this cancer growth or the mass or the lump, whatever we say, it is passed into that and taken some amount of tissue from there and subjected for the microscopic examination. So next day itself, report will be ready. That was not the scenario earlier. So things are very beautiful now. Breast cancer is curable. For the same reason we are talking today. It was not the picture earlier when I joined Kidwai 40 years back. Stage 4 disease, nothing was available those days. Now everything is available. Things are much better. It is curable. Better we talk like this. This is called community education.
Correct. Now my question to you is, if somebody feels some sort of a discomfort, or some sort of a feeling of a lump, what should be your advice to that particular lady?
Yeah, what happens is all the lumps are not cancer. That 80% of the lumps, especially young age. So that is called benign lump. Benign lump. Benign is, if we can take out that lump, patient will be perfectly all right. Whereas if it is a cancerous, with my FNAC, that is fine needle aspiration cytology, with the needle test, if it comes positive, we say positive.
Yes.
So if it is positive, then we have got treatment to offer. A treatment plan will be made for that given patient, and accordingly treatment will be given to the patient.
Correct. Now, I have very peculiar question to you. Who suffer more, urban women or rural women in India?
Urban and rural studies have been done, but as such, this is women disease. This is.
No, but which?
So maybe urban, maybe I have not referred those papers. Breast is a lifestyle disorder.
Okay.
That we have to talk more.
Correct.
Lifestyle disorder, like diabetes, hypertension, cardiac disease, all those things. These are all lifestyle diseases. So with my changed lifestyle, now we are almost, compare our disease is comparable to the Western world.
Western world, yes.
To that extent, now this program which you have planned is very much relevant. Very much relevant, because we do not have anything to offer as such for the prevention. So the program like this helps quite a lot. This is how we can know about the disease. Even doctors who have done MS also will not know, because 1 or 2 cases I see during my MS days. Not like, thousands together, lakhs together, seeing at Kidwai Cancer Hospital.
Yes.
So now, since in 1980, in 80s, this was a main disease in the Western countries. This is main disease. Now also it is main disease. Main problem there. So similar picture we are facing here in India. So that way your program is very much relevant.
Thank you. But now I want to ask you a very relevant question. When you started working 40 years back as a surgeon, I'm not saying the general involvement, but as a surgeon, when you started operating and maybe the time you retired, do you see there is an increase in patient from that time to this time?
Yes, definitely. Now in Kidwai, we have set up mine where I worked in surgical oncology department. So we register the breast patients, whereas gynec patients are registered in gynec department.
Correct. Is there any particular age where women will have this disorder?
Yes, this peak age incidence we say 45 to 55 years.
Okay.
This time there will be changes in the hormonal thing and all that.
Correct.
So this age group we get common this disease, but it is there is no bar as such for any cancer. Any cancer. Even I have seen a patient from Raichur, a lawyer. She was studying law, 20 years old. 20 years old. I have seen the patient 80 plus age group, 75 plus age group is my paper. There is one more paper I made, 35 years age, young age and the aged, both papers I did. Yes. And this young age group, if there is a tumor, it is aggressive tumor, we say.
Correct.
Growth will be very, very fast here in a young age group. Whereas elderly women, slow growing tumors.
Okay, I see.
Because they are receptor positive patients. About receptor, we'll talk later on.
Yes. Okay, now that you are telling me that age is not always same for this disorder, but my question is, especially after menopause stage, is it more risky for women to encounter cancer lumps?
No, this 45 to 55 only.
Okay.
45. So it will get into the menopausal thing.
Menopausal thing.
Menopausal thing.
How to precautions are available to delay if somebody is potential patient?
Oh, precaution as such, nothing is available. This is how this program of fevers. This way we will know lot of things. That is all the precaution. As such, there is nothing prevention available today to us. Maybe we can change our diet, this vegetarian diet, all that, green vegetable diet, color fruits one has to eat more, and this leafy vegetables. One study is done by Japan person. He had come to India. He worked for 10 years, and at the end, his result was this, supposed to help. It will not prevent, but supposed to help. Disease may be less in this vegetarian group like that. So he advises vegetarian diet. After 10 years of the study in India, like food main is food and pollution. It is very common in highly industrialized countries.
Okay, that's why Western
in America,
are suffering more.
In America it is there. So this, Dr. Kalam says nothing goes without payment. So once I am aiming for a developed nation, so disease development also comes there.
That's true. That's true. Every other discomfort is because of the change in lifestyle. No doubt about it.
Yes.
Now, doctor, tell me one thing. If unfortunately somebody has been suffering for it, so I read a data somewhere that unless it is in stage 3rd or 4th, women do not approach doctor. They do not take any step to prevent it. So now, what is the treatment process available? And what is the cost of that treatment?
Cost now? Now things are much better. Stage 1, we say. Stage 1 disease is where the breast lump is confined to the breast only. Stage 1.
Okay.
Stage 2 is where disease goes to the armpit area. Armpit area, lymph node involvement, but mobile lymph node, not stuck very hard and all that. So stage 1 and 2 are operable disease. Both are operable disease. Even stage 3 also, one can give a chemotherapy after the investigation and downstage the disease. That is called downstaging the disease.
Okay.
Such a wonderful chemotherapeutic drugs are available. Even whole disease might disappear or disease may come down. That is called downstaging. So the inoperable stuck disease becomes mobile. We will be able to operate. So that is called inoperable disease is converted into operable. So that is downstage. Happens with the pre-operative. Before the surgery, chemotherapy is given. Earlier, what used to happen was we used to do the surgery and give the chemotherapy. In 90s and all that, lot of studies have come to the world, wherein we can give the we can downstage the disease and operation is done. So standard treatment available today is surgery, radiotherapy not in all the cases, chemotherapy, almost all the patients they will receive the chemotherapy, and hormone therapy depending on the receptor study report. Receptor positive patients will receive the hormone therapy. Again, hormone therapy has revolutionized the treatment of breast cancer. Sorry, especially the postmenopausal. There we get a slow growing tumor, receptor positive patients where they can take the hormone treatment. And radiation, our understanding of the disease was not much because it was not our disease. Now it is our disease. Right. Now we have got in my hospital, Kidwai Hospital, super specialty is there. So lot of studying, research, so many things are happening. With that, my understanding increases. Earlier it was not so. True. More than 3 nodes are positive. Pathology report comes, only then they will go for radiotherapy, not otherwise. I went to one ASCO meet happens every year in America. All the global people participate in that, and because it is a Western disease, consensus are formulated there. Whatever consensus are ASCO meet, they say. So clinical oncologist. So whatever consensus occurs there in that meeting, that is the treatment for the globe. Okay. So there I participated in 2002. In that meeting, it was declared that even a centimeter lesion, 1 centimeter tumor patient is supposed to take the chemotherapy, because a centimeter a lump is considered as systemic disease. Okay. And there may be deposits somewhere, there may be cells somewhere which is not seen. So that was the dictum there in that meeting. So like that, consensus are formulated in that meeting, and that becomes the treatment all over the globe. We all follow that treatment. Got it. Thank you. Doctor, now that you are saying earlier it was a surgery and then chemotherapy. Now the first chemotherapy, and if at all it is not cured through that, then only the surgery is the next stage. Am I right? Surgery, once there is the downstaging, once it is operable, we will do the surgery. All patients will receive the surgery if it is operable. So biggest concern here is what we have seen as a layman. People who go through the chemotherapy suffer a lot, and there are a lot of side effects of chemotherapy. Is there any workaround for it? Is there any kind of a treatment for them to have a less suffering? Yes, such earlier there was we had a lot of chemotherapy side effects. Now it is almost minimal, because there are so many advanced medicines are available. A lady is worried about hair loss. Yes. So hair loss is a reversible phenomenon. After treatment, they will regain the hair. That happens. Okay. Only thing is, it is very, very lengthy, toxic. But anti-emetic drugs for the vomiting and all, we have got wonderful drugs. Okay. So things are very fine now.
Once person has gone through the treatment and recovered, there is a possibility of recurring of the
Possibility will be there all the time.
Okay.
All the time. But
Okay.
they should not think about all that.
No, should not think is one part. But
Yeah.
then how
Anyway,
to
they come
avoid
for
that?
follow-up every 3 months
Okay.
for the first 2 years.
Okay.
After that, 6 months, and then yearly after 5 years. So we say cure if patient can survive without disease for 5 years.
Okay.
Breast patient, they are living, fine. Picture is fine now as far as breast is concerned.
Okay. Okay. Now I want you to give a word of caution to the modern society that what kind of care or precaution they should take to avoid such thing or to delay the whole thing, if at all it is going to happen.
As such, with our changed food, changed lifestyle, and all in pollution everywhere, and using pesticides by the farmers. Maybe there is some stimulus in me, that will trigger the disease.
Is it genetic? If my mother had it, will I get it?
Not 100%.
Not 100%. Okay.
Even generation may skip.
Who are the high risk people?
High risk group. I will give you the list now. After in my slides, I've given beautifully. That is unmarried status. First delivery after 31 years. Then late menopause. Okay. Early menarche. Okay. Now early menarche state everywhere you are hearing.
Yes, it's very common now.
Very, very common. Late menopause. Unmarried people, this menopause after 55 years, they attained the menopause. And family history, like aunt, grandmother, mother having the or sister having the disease. So all these are high risk group.
High risk group. What somebody should observe if she is a potential candidate of breast cancer? What kind of a discomfort she will observe?
She will not have any discomfort as such. While taking bath, if I'm conscious of my body, I will be getting some lump. I will feel the lump while taking bath and all that. Okay. So if she is conscious enough, she will report to the doctor. She will go to the doctor. If doctor knows what it is, because all are not trained in the oncology. So they will invariably send to the general surgeon. General surgeon will detect the lump. So again, they will do the testing, this FNAC.
So, that is the doctor's part you are telling me. Yes, what I'm asking is, before that, as a individual, how do I know that I have this? What kind of symptom will I observe?
Breast lump, I will be,
Okay.
That is the primary cause. The breast lump.
Okay. That is a major
major breast lump. I will be able to feel the lump in the breast.
Okay.
Majority of them, they come with the lump in the breast.
Lump in the breast.
Some of the times nipple discharge, where milk comes, their blood may come.
Oh, okay.
That is because of block. That is a block there. That color will be, little black. That obstruction of the milk duct. So from the nipple, blood may come. But nipple discharge, young women, serosanguineous we say. It is not like that aged people. Aged people, I have to rule out malignancy. I have to rule out cancer there. Whereas young people with the nipple discharge, light colored, watery discharge, with a little button, that chota surgery we do. We remove that duct and she will be all right. Okay. So it's not a cancer. They may present to us with the nipple discharge, that wet thing and all that. No, that is disturbing for her. Okay. And sometimes, very rarely, the armpit lymph nodes,
Lymph node.
the swelling there, swelling there.
Mm, mm.
Invariably, this armpit swelling is available for my examination.
Okay.
Not for the patient will not know.
They will not know.
Yes,
You will
yes,
observe it
yes.
as a surgeon. Okay. Akka, one last question.
Hmm.
As a surgeon, how many operations have you done in your Kidwai tenure?
Kidwai plenty because I became professor very early age. At the age of 38, I became the professor.
Wow.
Once you are a professor, you have to run the show totally yourself. So breast is a common disease. So every OT list will be having at least 2 breast cases.
Okay.
So I worked for 30 years because it is a hospital, major hospital.
Yes.
We don't keep our own records as such. Some hospital maintains the records. I don't remember, but our life was only with the surgery.
True.
Yeah. Half of our life will be preparing the patient for surgery in the outpatient, and half of the year we live in the theater.
Yes. So thank you very much for your time and that word of wisdom. Hopefully, you will see more such programs and you will spread the awareness among the society.
Yes.
Because
this is very beautiful program. I know unless you have in your house, you will not know what it is. Advising to somebody is very, very easy.
Thank you for your time, and we wish you all the best and wonderful health. And please help others and spread the awareness.
Yes. Thank you so much. Thank you.
Namaste.
Thank you. Thank you. Namaste.